Would you like to end the pain and suffering from low back pain and or leg pain from an L4-L5 or L5-S1 disc bulge? Getting the best treatment for your L4-L5 or L5-S1 disc bulge or herniation could be the difference between living with constant pain and finding lasting relief so you can live a pain-free, healthy, and happy life. If you're worried about your disc bulge condition getting worse and you're looking for ways of getting rid of that pain without taking drugs or needing surgery, then this video is for you. In today's video, I will give you a comprehensive look at 3 of the best non-surgical methods for treating L4-L5 or L5-S1 disc bulge or herniation. So keep watching. These methods are safe, gentle, and proven to be effective. Not only can these non-surgical methods offer immediate relief, in most cases, they also target the root cause of the problem that's responsible for the damage to the disc. And this is key. That's what makes these treatment methods unique and different compared to conventional methods like drugs, injections, and surgery. Yes, it is possible to successfully heal an L4, L5, or L5-S1 disc bulge or herniation naturally and non-invasively, and I'm going to show you how we do it. So be sure to watch right to the end, and you'll be glad you did. Hi, I'm Dr. Steve Silverston. I'm a chiropractor in Ellicott City, Maryland, and I bring to you over 30 years of clinical experience helping people recover from conditions like low back pain, sciatica, neck pain, upper back, shoulder, arm, headaches, and more. This channel is about giving you tips and strategies to live a pain-free, healthy, and fulfilling life. Before I dive in, be sure to subscribe to this channel if you're looking for ways to enjoy a life free from pain and filled with health and joy. It's important to note that even in cases of advanced disc herniations causing severe back or leg pain, surgery isn't always the first or best treatment option. If surgery is not usually the first or best option, and when drugs and injections don't work, what options are you left with? That's the dilemma. Most people don't know about these 3 non-surgical yet extremely effective treatment methods that I'm about to discuss with you. They are corrective chiropractic care, flexion distraction therapy, and spinal decompression therapy. I will review each of these methods individually, starting with corrective chiropractic care. Corrective chiropractic care not only restores movement in the spine where it's needed, improves joint neurology, relieves pressure on the nerves, decreases pain, improves function, and facilitates healing of the cells and tissues, but it's also focused on restoring the spine to its optimal shape and position and helping those vertebrae hold their alignment, providing a long-term solution or correction of the problem. Structure dictates function. So if the structure of your spine's not right, it causes functional problems. And that's what most often underlies L4, L5, or L5-S1 disc bulges or herniation. Corrective chiropractic care gets to the root cause, providing a long-term solution versus temporary symptomatic relief, which often leads to eventual worsening. Corrective chiropractic care involves specific chiropractic adjustments or alignments, which when done properly are gentle, smooth, safe, and feel amazing, as well as specialized traction protocols and exercises, which all work together to correct or restore to as normal as possible your spinal, postural alignment and function. It's super safe, feels great, and often provides additional health benefits patients weren't even expecting at the onset of care. We have tons of sensational real-life stories from our patients. We'll have to do another video just on that. The second extremely effective non-surgical, non-invasive method of treating L4, L5, or L5-S1 disc bulges or herniations is using flexion distraction therapy, which is a gentle, safe, specialized chiropractic technique that gets amazing results, especially for L4, L5, L5-S1 disc bulges or herniations. The way it works is using specialized mechanical tables that flex and laterally rotate your body. We're able to target affected discs with very specific movements designed to remove pressure from the disc. This technique has been proven to decrease intradiscal pressure, pulling the bulged or herniated disc back in, and has been shown to even widen the spinal canal area by as much as 28%, all while restoring proper motion to the affected spinal joints, which is critical to restoring proper function and healing. It's gentle, relaxing, relieving, and patients love it. The third method I'll cover with you today is non-surgical spinal decompression therapy. Spinal decompression therapy in our office uses a computerized, motorized chair called the ErgoFlex Back on Track. It pulls the spinal vertebrae apart, allowing the injured discs to retract, taking pressure off the nerves and other structures while moving fluid and nutrients into the discs and moving toxins out of the discs so that they can heal and function better. It has 21 different settings to allow for different patterns of axial decompression of the discs, meaning it pulls and holds, it pulls and releases, it pulls in different directions and to different degrees depending on the settings that we enter. It does all this in a gradual, methodical way, which allows the body to completely relax and not fight the process, making it not only very effective, but a very enjoyable experience. The ErgoFlex Back on Track is super comfortable compared to other forms of decompression therapy, and also provides heat and vibration, enhancing the whole process and experience. Patients love it, and you will too if you have an L4-L5, L5-S1 disc bulge or herniation causing low back pain or leg pain. While flexion distraction and decompression therapy are similar in that they both pull the vertebrae apart, helping to take pressure off the disc to help it heal and function better, they do it differently, providing different benefits in the healing process of the bulged or herniated discs. And when used together with corrective chiropractic care, cold laser therapy, and nutritional supplementation, we've witnessed miraculous results with our patients, and that's why we've developed our world-class chiropractic health action plan, a comprehensive approach to healing. If you'd like to find out if this type of care is right for you, feel free to contact our office and set up a free consultation where you'll come into the office, you'll see the office, meet with one of the doctors, discuss your situation, have any of your questions answered, and see if you're in the right place to get the care you want and need without any cost or obligation. Most likely, if you're suffering from an L4-L5 or L5-S1 disc bulge or herniation, this may be what you've been looking for to heal once and for all and achieve long-term correction of the root cause of the problem. With over 30 years of experience, we've seen great success with our comprehensive approach. Before coming to our office, John underwent 2 lower back surgeries, 18 months apart, for an L4-L5 disc rupture. Each time, the surgeries gave him some relief, but never fully resolved the problem, which would continue to cause pain, decreased flexibility and movement, and prevent him from being active and being able to run, play basketball, and pursue his greatest passion, which is golf. Getting on a program of corrective chiropractic care, flexion distraction, and spinal decompression has helped John be able to live pain-free and maintain a normal, active, healthy lifestyle, and most importantly, according to John, has helped enable him to play golf and achieve one of his lifetime goals of playing golf in every state, all across America, in all 50 states, which he accomplished last year. This is one of his favorite accomplishments, which John attributes having this care enabled him to do it and enjoy it. We had another patient named Martin. Martin came to us many years ago in severe debilitating pain. He had a ruptured disc, which, by the way, is worse than a disc bulge or herniation. A bulge disc, if not properly addressed, can progress to a herniated disc and can eventually turn into a ruptured disc. That's usually the way it happens unless someone has a major trauma like a car accident or train wreck that could cause all that damage at once. In Martin's case, there was no major trauma, so this had happened progressively over time. His disc actually exploded and there were pieces floating around in the spinal canal. He was told by the neurosurgeon that this was a dangerous situation and that he needed immediate emergency surgery. He really wanted to try to avoid surgery and heal naturally, so he found our office and came to us against the surgeon's recommendations, and he asked us to help him and see if he could be healed naturally. We accepted his case only with the clear understanding that if we didn't see immediate and consistent improvement in his condition, that he might in fact require that surgery. We carefully went to work and we did see immediate improvement in his condition. His case was quite severe and it actually took the better part of a year, but he did heal and was feeling and functioning at 100%. He had miraculous results and felt he had completely healed. When he reached that point and he was working and feeling 100%, I suggested to him that he continue to receive periodic care to maintain the health of his spine and prevent the chances of a recurrence, but he politely declined. He was thrilled with his entire experience and grateful that we were able to help him, but he did not want to continue to have to come in if he wasn't hurting. So I didn't see him again until about 15 years later when I bumped into him in the supermarket. I was excited to see him and curious about how he was doing, and he told me that he continued to do the exercises and home care that we had given him. And in all these years, despite having had such a severe problem, that he has had zero problems since leaving our office. So you see, it is absolutely possible to heal naturally without the use of drugs or surgery, even from severe cases of L4-L5 or L5-S1, disc bulges, herniations, or even ruptures. I hope you now have a better understanding of these three non-surgical methods and what they can offer you if you're suffering from an L4, L5, or L5-S1 disc problem. With this information, you are now armed with the knowledge and awareness to make a more informed decision as to whether you should seek out these therapies to help you with your acute or chronic disc bulge or herniation. Now it's your turn. I would love to hear from you. How long have you been dealing with an L4, L5, or L5-S1 disc bulge or herniation? How has it limited your daily activities? Please share your experience or ask any questions you may have in the comment section below. If you found value in this video, be sure to like it and share it with others so they can also benefit and learn all about these three non-surgical treatment options for L4, L5, or L5-S1 disc bulge or herniation. Also, go ahead and subscribe to our channel right now if you want to learn more ways to enjoy a life free from pain, filled with health and joy. The next video you should watch is this one. You will learn all about laser therapy for treating L4, L5 disc bulge or herniation. Cold laser therapy is safe, effective, and has been proven to regenerate the tissues and speed up healing time. Go ahead and watch this video next.